to the ocular clinic. I'm your optometrist, and I just want to take a look at some of your notes. So, you are under the eye hospital. You see your ophthalmologist annually for glaucoma, and you was diagnosed with the glaucoma approximately 30 years ago, and you take drops, is that correct, each night, both eyes, to maintain a good intraocular pressure level. So, do you find the drops comfortable when you instill them? Good. And your next hospital appointment for the glaucoma check should be in 3 months' time. Okay, that's fine. So today we're going to do a few ocular tests just to see how the eyes are performing. Okay, now, keeping the two eyes open, we are going to do a vision test. Okay, so we have a card. Just tell me the letters you can see. You want me to move it to your left? Good. And is the chart cut off there? Okay, so missing a little bit of the chart. Okay. Let's try the next set of letters. Okay, what can you read there? And the final row, and if I hold it centrally, are we missing any of the chart? We're missing one letter at the bottom. Okay. So the glaucoma is obviously causing some gross visual field loss. Okay, let's try one more vision chart. Again, just say the letters in any particular order. Okay, and there you feel you can see all the letters. Are you missing any edges of the chart? So upper there and lower right here. Okay. Right. Let's do a little confrontation test. So I'm going to ask you to tell me when this pen tip appears in your vision. Just shout out. So, just looking right between my eyes. Just tell me when you see the pen. Tip of the pen appear in your vision. Just there. Okay, and let's try from a different angle. Okay. Okay, let's try the left side. Let's try again. Okay. And here. Okay. And from the bottom. Okay, and let's just try here. You see the object there. Okay, so maybe we're missing more field on this side and a little bit there, but more to your right hand side. Is that correct, would you say? Okay. Just looking straight ahead now. I'm just going to check your pupils and how they respond to the light. So it's be a little bit bright. Just look straight ahead for me. So we're checking the right response there and the left. Good. Let's check the left, shining the light in the right eye and vice versa. Okay, let's do the swinging flashlight test. From right to left, as I watch your pupils constrict. And again, just another peripheral vision test very quickly. Just tell me when you see the light. Okay. Keep looking straight at me. Okay, you're doing fine. Okay, thank you. Okay, so I have this illuminated magnifier here. And we have a series of lights, and I'm just going to be observing your external ocular area. Okay, just look straight ahead as best you can. And I'm just paying close attention to the conjunctiva, just looking at the iris. Okay, good. Come a little bit closer. Okay, just looking up, looking down, looking to your right and left. Good job. Okay, let's check the left eye. Looking straight ahead again. Do you suffer with headaches, particularly frontal or around the eyes? Not really. That's fine. Now just look to your right hand side and left, up to the ceiling for me, and down to the floor. Okay, not too bad. Okay, so we're just going to do a shadow test, which just involves me shining the light from each side at an angle, just checking the anterior chamber depth. So just looking over my shoulder at the wall in the distance, and I'll check the angle on the temporal side, looking how much shadow is created. The light, looking maybe grade 2, grade 3. Right eye temporal side and the left side. Keep looking straight behind me. a shadow in the anterior chamber. Again, maybe looking at a shallower angle, the left temporal side, grade 2 to grade 3. Okay, so the angles are definitely open, so there is room for the aqueous humour to drain out of the eyes. Okay, I think we should do some tonometry now. We just need to pop a little bit of fluorescein dye into the eyes, which does not sting and will not affect your vision. So I'll just wet the tip. Okay. The tip there, just looking up to the ceiling for me. You won't feel a thing. Continue looking up. Pop some in the left on the conjunctiva. Okay, take a few blinks now. I'm just going to set up the Goldman Tonometer. Sure that the probe is securely fixed. Nice clean sterile probe. And we'll start based on your intraocular pressure history. We'll start at 16 millimeters of mercury. Good. I'll just place that on the machine in a second. It's important that we dim the room lights and use some cobalt blue light. Okay. Just bear with me. Okay, your job is just to look straight ahead. Let's just get the light at the right angle there. Good. And the probe now will gently touch the eye. Okay, so we have a reading of 15 mil of mercury. Just looking straight ahead into the distance. I'll take another reading with the Goldman Tonometer. Touches the eye, you won't feel a thing. Okay, let's have a look at the results there. Okay, we're looking at 18 millimeters of mercury for the left eye. Excellent. So it's important that we do some retinal viewing with glaucoma, paying close attention to the optic nerve head, checking for any glaucomatous changes, and reviewing the cupping and the general appearance of the disc. I'll start with some green light, normal daylight conditions. Straight ahead for me. Just hone in on the optic nerve of the right eye. So cupping appears unchanged since your last appointment. Looking at around 0.8 cupping and significant loss of the inferior neural retinal rim. No evidence of any disc hemorrhages. A little bit of beta peripapillary atrophy. developing. Okay, let's switch to the white light. Dim the lights. Okay, this will just allow the optic nerve head to appear in its normal state of pinkness, which the neuroretinal rim does look fairly pink. Just that loss of inferior rim. And an obvious lamina cribrosa from the glaucoma damage. So it's vitally important that you keep taking your IRP drops to keep the pressure in check. Okay, let's just observe the left eye. Let's start with the green light again. Keep looking straight. And cupping the left optic nerve head. Looking at approximately 0.9 cupping, so we have significantly more optic nerve head damage from the glaucoma. If I recall, this was the eye with a slightly higher IRP reading. Okay, but now hemorrhaging. Maybe some loss of inferior rim. And slight pallor of the optic nerve head. It's a slightly off pink. Very well done. Let's just switch to the white light again. Keep looking straight ahead, as if you're looking through me. Thank you. Okay, this just allows a little bit of colour contrast compared to the red free filter. 0.9. Okay, so I think we should do a visual field test on the machine next, just to monitor your peripheral vision and see if anything's got any worse, and we will certainly print those results out for hospital attention. Good. Okay, just before we wrap up the appointment, I'm just going to take some iris measurements here. Just looking into this eye for me. The ruler there. Looking into this eye now. Okay, that's the vertical reading. Looking this eye again. Okay, vertical reading of the iris. It's about 11.5 millimeters. Okay, let's check the horizontal of the right eye, looking into my right eye there. So 11.5. And looking into my left eye. Grand. So 11.5 to 12 millimeters. And the iris. And the pupil sizes now. Look into the side, and we can just check along the scale a reading of around 6 millimeters. Into this eye now. Let's move along the scale 4, 5, 6, 7. A little bit less. 6 millimeter pupil size. So the pupil sizes are equal in bright conditions. Excellent. just have a look at the file from previously and just compare the results. It's probably going to be worth me giving you a handout to take to the hospital with the result of today's tests. Okay, so IRPs have been on a steady plateau since 3 years ago when you started your new drops. Okay, good. Let me get a letter printed out for you to take to the hospital. And I think that concludes our appointment today. I'll see you again in 1 year's time.